Strabismus, which is basically seen in a lot of patients, it is characterized by the misalignment of the eyes when the person is focusing on a distant object. So this is the main clinical presentation of a person who is suffering from strabismus. Now, the patients can range from children to even the adult age group. The children would usually present to you with the congenital kind of a strabismus, and on the other hand, it can be a slowly occurring or a slowly developing strabismus in the age group of 1 to 12 years old children. Now, the treatments would basically differ in these different age groups. So again, it's very important to know the causative factors or to know the correct assessment of the patients whenever we are dealing with strabismus or a patient of strabismus over here. So whenever you see this misalignment in the children or even in the adults, you would start off with the correct form of the history taking to diagnose the kind and the type of the strabismus in this particular person who is basically presenting to you with this misalignment or with the complaints of the misalignment. History taking would start off definitely from the patient particulars, and then we'll move on to the presenting complaints. When did the parents start noticing this kind of a misalignment in the child is again very important. Usually, the parent would give you a history that he or she started noticing this misalignment right from the start. But it's quite a normal phenomena when we see infants who have this squinting phenomena or who are suffering from misalignment. It's not pathological at all until it is almost 3 to 4 months old age group. So it is normal to have this misalignment in the children, but the child should have a proper focusing and the alignment of the eyes after this 4 months of age group. So the infancy period is not a period to correctly diagnose an infant to be suffering from strabismus. It's after that you diagnose the patient or the kid to be suffering from strabismus. The types of the strabismus, when we categorize strabismus over here, which we will be doing in this section, it depends upon the multiple classifications that are out there and they are clinically applicable. Obviously, the types of strabismus which range from the kind or the causative factors of the strabismus or the squinting phenomena, which is again going to be due to the congenital forms of the strabismus, and again we see the acquired conditions of strabismus in the adults. When we say it is the acquired conditions, that would be due to any kind of traumas or any kind of systemic conditions that the patient is suffering from. Again, history taking is very important over here. You're going to start off the history taking from the past history or the past medical and the surgical history. You'll focus on these particular conditions. The past medical history would encompass any kind of stroke that the patient is suffering from, TIAs, any CVAs, that is the cerebrovascular accidents, transient ischemic attacks. All of these have to be highlighted when you're taking the past medical history from the patient. The patients of Down syndrome, usually, if they're coupled up with these strokes or these TIAs, CVAs, they usually present with this strabismic kind of condition. So the past medical conditions is again very important. And then we have the past surgical conditions, any history of recent surgeries or even histories of surgeries in the past, and even any history of trauma in the recent past should be signified at this level when you're taking the history from the patient of strabismus. Once the past medical and surgical history is done, you're going to move on to the socioeconomic history, the personal history, the history of smoking, any drug addictions. All of this has to be noted down whenever you are taking a complete detailed history from a patient of strabismus. The types of strabismus would be inculcated clinically. You're going to see whether it is a cross-in phenomena as seen in the esotropia, which we'll be discussing further on, and we'll be also discussing exotropia, that is basically a cross-out phenomena. Then we have the hypertropia, in which there is a superiorly deviated eye, and then we have the hypotropia, in which there is an inferiorly deviated eye. On the other hand, we have the additional classifications relating to this strabismic kind of a condition. The additional classifications, which again based upon the incidence and the prevalence of this condition of strabismus in the children. So over here, we're going to discuss the different causative factors, the different types, the different classifications of strabismus, depending upon the age groups, depending upon the causative factors that are making the person more prone to the development of this condition, which is known as strabismus in these children. So over here, you can see that we have this male and female population, but the males are affected more than the females, as you can see in this bar graphing phenomena. The esotropia is a condition which is more frequently seen as compared to the other types of this strabismus. When we compare exotropia from esotropia, it's almost half a difference. So the incidence of esotropia is more, that is the cross-in phenomena, and the cross-out phenomena is a lesser version of strabismus that we see. We have the vertical versions of the strabismus, the DVDs, and the other types are very less. So this is a bar graph which is showing the frequency of the cases of strabismus in the male and the female population. That will give you the fact that the males are more prevalent, or the males are more prone to the development of this strabismus kind of a condition. The esotropia, which is also the inward turning of the eye. We have the exotropia, which is the outward turning of the eye. Hypertropia, which is the upward turning of the eye. And then we have the hypotropia, which is basically the downward turning of the eye. So these terminologies basically, which are the eso, exo, hyper, which is relating to the superior deviation, and hypo, which is relating to the inferior deviation of the eyeball. So all of these, in which you can see that it's basically the misalignment that we're talking about, and all of the terminologies are relating to the direction of misalignment over here. So it is one of the ways how we classify clinically strabismus by the clinical presentations. Over here, you can see in this child, you can see that there is an inward deviation. Inward deviation was termed as esotropia. So this condition is one of the clinical presentations of esotropia. The definition would be the left eye is turned inwards. Note that the light reflection in the eyes is not symmetric. So even if you perform, this is one of the highlight for the examinations. Light reflections is not going to be symmetric. You're going to perform the light reflexes, and you're going to see that this is not going to be symmetric in both of the eyes, and you can see that it's just medially located over here, but over here it is slightly deviated because the eye is deviated medially. So pupillary light reflexes, all of this can be examined in the patient, and you can just demonstrate that the patient is suffering from esotropia, or either he or she is suffering from some sort of exotropia in this particular condition. Over here, you can see this is a case of exotropia. Why? This is because there is an outward deviation in the right eye, which is noted over here. The left eye is quite normal, and in the right eye, you can see that there is an outward deviation. Again, you would see that the light reflexes are noted down over here. They are not symmetrical. It is inside the pupil and it is outside the pupil, located quite medially because of the outward deviation of the eye. So this is the proof that the patient is suffering from some sort of an exotropia. The right eye is turned outwards. Note the light reflection is in the eyes is not symmetrical, again, even in this case of exotropia. Then we have the hypertropia, which is basically the superior deviation of the eye. Over here, you can see, even here, you can see that the light reflexes are not symmetrical, and there is a slightly superior deviation of hypertropia noted down in the right eye. Then we have the right eye is turned upwards, and the light reflection is not symmetrical even in this case of hypertropia. Then we have the hypotropia. Hypotropia, as you can see over here, the eye is deviated inferiorly, and this condition is again known as hypotropia in these individuals. Over here, the right eye is turned downwards, and light reflection in the eyes is not symmetrical either over here. So whatever the case may be, whether it is a medial, whether it is a lateral, superior or inferior deviation of the eyeball, the light reflexes are not going to be seen symmetrical in any of the cases. So that is one of the proof where you can just demonstrate that the person is suffering from some sort of a strabismic condition. There is a misalignment which we are going to prove, and this misalignment is not due to any other abnormality that the patient is suffering from. So this is this is the definition of strabismus, and that is what we are proving down in every type of strabismus that we are talking about. We also basically give the terminologies of convergent squint, in which there is a bilateral esotropia. Then we have a divergent squint, in which there is an bilateral exotropia. Then we have a vertical squint, which is basically the hypertropia, which is seen bilaterally. So all of these terminologies are going to be seen in the bilateral conditions: convergent, divergent, or either it is going to be a vertical squint. These terminologies are relating only to the bilateral conditions of the strabismic phenomena that we're talking about. The constant or the intermittent kind, the frequency it occurs, so it's depending upon the fact that whether it is a constant strabismus, the patient, the parent, or the patient himself or herself will give you a history that it's constant strabismus noted down by the parents. It's going to be throughout the time, and there is no particular time. And usually if it is an intermittent kind of strabismus, it is an amblyopic condition that the patient is suffering from. It is usually the condition of a lazy eye that we should consider whenever the patient is giving you a history of squinting that is intermittent, or usually when the child wakes up, he or she is suffering from this squinting or a deviated eye, or the deviation is more visible when the patient just wakes up. So this is more towards an amblyopic eye rather than a strabismic eye over here. Then we have a bilateral condition, both eyes converge or diverge at the same time. Then we have a unilateral conditions, if it always involves the same eye. So you have to note down all of these peculiarities. When you're taking down the history or when you're examining the patient, you're going to see whether it is a bilateral or unilateral condition, whether it is unilateral. If it is unilateral, is it a consistent condition or is it an intermittent condition? Is it related to the time? Is it related to the sleep? So is it related to the stress? So all of this has to be highlighted when you are taking a complete detailed history from the patient. Then we have an alternating squinting phenomena, in which the patient will give you a history that his eye is deviated on the right, his right eye is affected first of all, and then it follows on with the left eye deviation. So when the turning is sometimes in the right and in the other times it is in the left eye. So these are the different classifications that we usually encounter and see in the patients of the strabismus. Having talked about the different sorts or different types of strabismus, we now know that the deviation is going to affect the terminology that we're going to use in the documentations, or when we're going to use it or terminize it or diagnose a person, whether he or she is suffering from esotropia, whether he or she is suffering from exotropia, hypertropia, or either it is a hypotropic kind of a condition. If the eyes are convergent or they are converging medially, that is the case when we say we have an esotropic kind of a condition. Exotropia is when the eyes are deviating laterally. We're talking about a unilateral condition over here. If it is a bilateral condition, for instance, we say that the eyes, both the right and the left eyes, are converging or deviating medially, then it is going to be a convergent squint. On the other hand, when both the eyes are deviating laterally, if you can visualize or if you can imagine that even this eye is deviating laterally, then we are going to say it is a divergent squint. So if it is a unilateral condition, esotropia and exotropia are used. If it is a bilateral condition, we are going to use converging and diverging squints. On the other hand, we have hypertropia. Hypertropia is also known as a vertical squint if it is present in bilateral condition or if it is present in both of the eyes over here. So then we have hypertropia, in which the eyeball is deviated inferiorly. It is usually a unilateral condition. So these are the different types of strabismus as seen, and it's given for comparison that you can see what is the difference between these different kind of strabismic conditions. When does it occur? So it's again the prevalence or the incidence is again very important over here. How can we say that it is a congenital condition or whether it is a acquired condition? And what are the different causative factors towards development of this condition? Developing during infancy, and 50% of the children are even born with this kind of a condition. If the patient is suffering from Down syndrome, it is one of the major risk factors for the development of strabismus. You're going to examine whether the child is suffering from continued strabismus even after the 4 months of age, and 1 year is the cross section point, and you are going to examine whether he or she has developed any improvement in the eyes or not. The acquired conditions has also to be looked upon. Developing in the adulthood can also develop due to the lack of treatment during the childhood. So one of the reasons can be the continuity of the strabismus from the childhood. So it's not important that it's an acquired condition, so it didn't happen in the childhood. You have to basically track down the history towards the childhood of that particular person. So usually any infections, any trauma, it can be a recent trauma, it can be a surgical trauma, even all of these conditions can result in an acquired condition of strabismus in the children. There are a lot of misconceptions that are related to this strabismic kind of condition. Strabismus is not the same as amblyopia. Amblyopia is also called as lazy eye, and amblyopia is a condition where the vision doesn't develop normally during the childhood and the eyes become lazy with the passage of time. So this is one of the misconceptions that we have to clear whenever we talk about these kind of misconceptions. Then the child may have one weak eye with poor vision and one strong eye with a normal vision. So it's one of the causative factors over here that you're going to basically look upon. The eye which has a poor vision, the brain is not going to interpret images from the poor eye or the poorly functioning eye. The brain is going to interpret images from the normal eye over here. Amblyopia doesn't occur commonly with strabismus. So usually what happens is strabismus can lead to amblyopia, and sometimes these conditions are superimposed, and that is why they're even confused. Even the treatments are quite similar. Eye patching is the most effective treatment in amblyopia, as well as eye patching is a very effective treatment in strabismus. But the underlying pathology is going to be different in both of the cases, whether it is strabismus or whether it is amblyopia. But again, it's very important to distinguish these two cases particularly because the treatment and again the prognosis and the final outcomes would be quite different in both of these cases. Amblyopia, again, if we look at it, it is a vision problem and is not related to the squinting, or it is not related to the deviation of the eyes. It is the poor development of the vision during the early stages of life that is basically going to result in an amblyopic eye, or that is going to result in a lazy eye in the individual. And on the other hand, strabismus is a muscle problem. So you can see over here that amblyopia, which is also known as a lazy eye, that is not due to the problems with the muscles of the child. It is a problem due to the vision development of the child. And on the other hand, strabismus is due to the weakness of the muscles of the eye that is basically resulting in the deviation of the eyes. And due to this deviation, that can be the reason for a poor development of the vision in the child, and that is why strabismus can lead to the amblyopic conditions, and it is one of the causative factors towards the development of amblyopia in the children. So over here, we gave an overview regarding the classification of strabismus. How do we basically clinically categorize or classify these cases of squinting phenomena or these cases of strabismus in the children is again very important. The causative factors, the risk factors are again very important, and they're summarized over here. So that is the end of this section. Thank you for watching sqadia.com.